Is cannabis safe? Let's talk about it. Hi, I'm Shannon. I'm the founder of Weed Mama, a lifestyle brand that teaches you how to use cannabis to feel better. Now, just to be clear, what we're going to be talking about in this video are THC products that you can ingest or inhale. So basically the stuff that gets you high. This does not include your THC lube that you've been using or your THC bath bomb, nor CBD or any of your CBD creams. Those are all perfectly safe. Now, I have read the entire CBD findings on the WHO website, the World Health Organization. CBD is incredibly safe. Cannabis in general has very low toxicity, especially when you compare it to something like alcohol. Cannabis cannot kill you in any dose that you can ingest or inhale. You cannot die from an overdose of cannabis. Cannabis also does not cause cancer. In fact, it is being studied for its anti-tumor properties. Cannabis doesn't even cause lung cancer when inhaled, when you're smoking joints. So I think there can be a misconception that for THC that it's perfectly safe to use, but it's not for everyone. Cannabis is a medicine. It's been used medicinally for thousands of years, and it is used to treat many different ailments. But like any medication, there is side effects and there's risks. And I'm going to talk about those side effects and risks in this video so that you can make an informed choice when using any cannabis product. Okay, so I'm going to repeat myself here, but just to be clear, we're going to be talking about THC products that get you high. Those are the products where you can find risks. Now, with other things like CBD, there might be some drug interactions. For example, if you're on blood thinners, that's something you'll need to talk to your doctor about. But otherwise, CBD and any of the other minor cannabinoids are very safe. All right, so let's talk about THC, the stuff that gets you high. First of all, I'm going to talk about the side effects, the common side effects that you can experience when using cannabis. Then I'm going to talk about Delta-8. And then I'm going to talk about the heart, psychosis, addiction. I'm going to talk about mental health things such as anxiety and depression. And I'm going to touch on pregnancy and breastfeeding at the end. You can jump around the timestamps below to whichever topic you want to hear about. But let's get into it. Let's talk about the common side effects that you can feel when using THC. So these are side effects that you feel when you're using THC that will wear off when THC wears off. Now, it depends on how much you're using and it depends on the product, but you can sometimes get red eyes, dry mouth. It can make you a bit forgetful as it affects your short-term memory. Now, if you're taking a dose that's too high for you, then it can make you feel anxious. There's a sense of paranoia that can be felt with high doses of THC. If you're taking too much of it, you can also feel nauseous and you can even vomit. And it can make your heart race. So those are the common side effects that you can experience when using THC, especially if you're using too much or you're using the wrong product for you. So let's get into Delta-8. Now, Delta-8 isn't even available here in Canada. They pulled it from the market. They pulled it from the market because they want more research done on it before they release it back into the public. Now, Delta-8 is found in small amounts in the cannabis plant. However, the products that you buy that are Delta-8 products are synthetic cannabinoids. How they do this is when CBD is subjected to a chemical reaction involving an acid catalyst, which converts it to Delta-8. Then it goes through a purification process, removing any toxins and residual chemicals. Now, the problem with Delta-8 products, the synthetic products, is that they're not really researched. You also have to be really careful who you're buying it from. You want to make sure that they are giving you a product that's pure. Delta-8 is very popular because it's, considered to be THC light or like diet weed. It has a much lighter feel. Now, I was able to try Delta-8 gummy from a hemp farmer in the United States. And I told them, what my normal THC dose was. And for me, that was around 7.5 milligrams. So she told me 20 milligrams of Delta-8 would probably be the right amount. So I took a 20 milligram gummy and it was very mild, but it did feel a little jittery, kind of like I had about 8 cups of espresso. It was like a caffeine jolt a little for me. Then when it came on the market here, it was sold in bags of 10 milligram gummies. And so I took the same amount. I took 20 milligrams and I had a horrible reaction to it. The most severe panic attack I've had in years. Now, when you take an edible, when it starts to kick in, you get this rush feeling. And that rush feeling is when you can have that rapid heart rate, feel a little like jittery and keyed up and anxious. But this was intense. That was my reaction. That's not the reaction that other people have. But overall, I'm not a big fan of Delta 8 personally. I don't want to take a synthetic cannabinoid when all you need to do to get the same effect as Delta 8 is to take a low dose of THC and combine it with a higher dose of CBG. This will kind of give you that feel you're looking for, or you can use CBD too. I find that CBG and CBD work really nicely together. But overall, I would be very cautious about buying vape pens especially. And you just want to make sure that if you are using Delta 8, that you're getting it from somebody you trust and the product is clean. Okay, so let's move on to the heart. Now, with the heart, this is where it gives me some pause. So there was a big study that came out about the heart recently. And you see this cardiologist here on TikTok with his, I wouldn't use any cannabis product. Now, I just want to say, if there's any doctors watching this, that when you're going to talk about cannabis in this way, that you're more specific, that you mention that you're talking about the products that get you high, like THC products that you ingest or inhale, so you don't scare people who are just using a THC lube and think that it's going to hurt their heart. Basically, what the study was showing is that it can increase your risk of heart attack and stroke, but it can be problematic for somebody who is high risk, has had a heart attack or stroke before. If you're on heart medications, like if you have a pacemaker, you might want to think about avoiding THC products. Just from the research, there's a lot more research that needs to be done, but it is showing that it can be very risky. For people who are at high risk for heart attack, you should probably avoid using THC products, in my opinion, but also in the opinion of cardiologists. And it is dose dependent. So again, the higher dose you're using, the more often you're using it, the greater the risk. Now, THC, what it can do is it can cause blood pressure fluctuations. It does increase the risk of heart attack in people who have had a heart attack previously. And like I said, there is this study that came out that shows that there is a higher risk of developing heart attack and stroke from using higher doses of THC on a daily basis. If you smoke it, that's going to put you at a high risk as well. Now, the thing about cannabis studies is that for every study that you find, you can find the opposite study. So I can find a lot of studies that also talk about the benefits to your heart as well. For example, that it reduces inflammation in your body, THC. It also promotes vasodilation, which is the widening of blood vessels, and it may have cardioprotective effects. And it also reduces stress and anxiety and helps people sleep. And keep in mind, something like alcohol also increases your risk of developing heart attack and stroke too. So for me, I know I've read these studies and I understand, and I use a lower dose, but I also use CBD and CBG as well. So if you're somebody who is very high risk for cardiovascular issues, this is something that you're going to want to consider before trying THC products. Okay, so let's move on to psychosis. This is another one that's very much rooted in racist propaganda that's going to make you insane, going to get a permanently insane psychosis. No. However, if you have a genetic vulnerability to psychosis, to mental health conditions like schizophrenia, which can cause psychosis, especially if you are young with a developing brain, this can lead to an early onset of the condition. And there's a problem with young people using really high doses of THC now. There's like 99% THC extracts that you can use. And if you are somebody, like I said, who is predisposed to these kinds of conditions, you're putting yourself at high risk using these products. I do know people who have conditions that do cause psychosis who do use THC and find that it helps them. So again, if that's you, you're going to want to do your research and talk to your doctor before choosing to use these products. And the other mental health issue that we can talk about here too is anxiety and depression, because a lot of people use THC to help with anxiety and depression. And studies have shown that using lower doses of THC can actually help anxiety and depression. But it can have the opposite effect when you start going into higher doses. And I've seen that in myself and people that I know. As a content creator who makes content around cannabis, I use products on the camera, and I accidentally use too much. I learned a long time ago to start using CBD when filming. And that can trigger anxiety, it can trigger panic attacks. And I've also known other people that had problems when they were using it too much throughout the day, and they ended up feeling worse. They ended up making their depression worse and their anxiety worse. This is why I teach the methods that I use to keep your dose low so that you are getting the medicinal effects of THC and not having it work against you. And I just want to say something here for the parents that might be watching. If you know that your kid is using THC products, I do recommend that you buy a CBD and CBG capsule, or you can get powders, you can get everything, you can mix it into their drinks or something and give that to them every day. And the reason why is CBD has been studied for its potential antipsychotic properties, and it counteracts the effects of THC. So it may reduce the risk of THC-induced psychosis. Now, CBG is a neuroprotectant and protect brain health. Now, CBD and CBG work synergistically, enhancing the effects of each other. That's why I say that you should find the two of them together. You can find them on the market, THC-free. One little thing that you can give to your kids to protect their brains if you know that they're using THC. All right, so let's talk about addiction. Now, cannabis is not addictive in the traditional sense. In other words, cannabis does not make you physically, or THC does not cause a body dependence on it. You're going to become physically dependent on THC. So we call it cannabis use disorder. THC can make you feel euphoric. And if you have an addictive personality who might get addicted to that feeling of euphoria, that can be a problem for some people. And so if you're using high doses of THC on a regular daily basis and it's making it so that you can't hold down a job and it's affecting your personal relationships, then it's a problem. But overall, cannabis is not addictive. You're not going to become addicted to it unless you're somebody, like I said, who does have a more addictive personality type and you think that that might be problematic for you, then you shouldn't take these products. But everyone else, I mean, stoners have been using cannabis for a long time and getting on planes and going to other countries where they can't use cannabis because it's illegal. So, you can't take cannabis on a plane with you and you can't use it in these countries. So you might get some withdrawals if you're using it daily, like you might get a headache, your sleep might get disrupted, but these symptoms wear off. And it's not like other substances like nicotine or alcohol where you can become very addicted to these substances. So finally, I'm going to touch on pregnancy and breastfeeding. Now, I wrote an entire article about this. I'm not going to go on too much about it in this video. I implore you to go read the article where it has links to different studies and things that you can look at so that you can make a more informed choice for yourself. In the cannabis space, there are a lot of cannabis moms that are advocates for using cannabis during pregnancy. I'm not. I, however, support women who feel that using THC during a pregnancy is better for them than using the prescribed medicine that the doctor is giving them for example, hyperemesis. I can't remember how to pronounce that, but that's when you have severe nausea and vomiting in pregnancy. And I've talked to women who did have that, and the prescriptions that they were given from their doctors made them feel groggy, but THC worked better. There isn't really good research yet to know how THC will affect the developing baby in the womb. My light just died, but we're almost at the end of this video, so I'm just going to keep going. So you can do your research around using THC in pregnancy if you are finding that you're having some severe health issues like vomiting and you think it might help you better than the drugs that they're going to prescribe you. This is where I kind of think that maybe THC might actually be better. There's not enough research yet to say that confidently. All right, let's talk about breastfeeding. Okay, so breastfeeding is an interesting one because, again, there's not a lot of data here about it, but I know for myself, when I was in the hospital after giving birth to my son, I had an emergency C-section. I still had I had morphine drip. I had there was drugs that were in my system to prevent blood clots. I was taking a cocktail of drugs, and they insisted that I breastfeed. They said it would be fine. I was also told by a midwife who was a nurse who said that I could use Guinness to help promote breast milk. And I said, well, won't that alcohol get into my breast milk? She says, it's just an infinitesimal amount. Don't worry about it. And there's a woman named Maya Elizabeth. She is the owner of Wellness. And so she had access to a lab to test THC products because she makes THC products. And because she was breastfeeding and using cannabis, she wanted to know, like, am I giving THC to my baby? I should check this. So she sent her breast milk into the lab to be tested. It came back negative for THC. So that's just the information I'm going to lay on the table for you. And you can do with that as you will. Again, there isn't any research yet to say whether or not cannabis, or THC specifically, is safe to use in breastfeeding or pregnancy. But I hope this video helped to give you the truth about using cannabis and its risks so that you can make a better choice, a more informed choice for you and your health. Do visit my blog, weedmama.ca, where I have a lot more information about cannabis. I'm up here in Canada. I do a lot of product reviews of Canadian products, which is good. If you're going to visit Canada, you get to know what's good and what to buy. Do subscribe to my channel. I take approach of using cannabis for feeling better. So using it with your health in mind. All right. Thank you so much for joining me. Bye now.